Goeiedag, good day, fellow South Africans and citizens of the world. And yeah, I'm the Kiwi for the day, okay? Just get over it. So now you know what's behind this red shirt. I love New Zealand. But let's get back to the subject at hand. And that is, what is actually going on in South Africa when it comes to the coronavirus? Well, I can tell you that there are two concerning things happening, which is, I'm not trying to shout myself out here, but I said this over a month ago. This lockdown would fail because of the conditions in the townships, because you can't have social distancing. And the second thing I said was that you will find that there's going to be a huge increase in infections during the lockdown because it's broken, it can't work. And I've been right in both cases. Now, I'm going to tell you what's happening in South Africa. This is yesterday. 385 new COVID-19 cases were reported in the past 24 hours. The highest daily surge since the country recorded its first case in early March. Now remember, South Africa has been in lockdown for close on 6 weeks. So they should be, when it comes to that so-called curve, they should be leveling off and starting to move down again. Because it's 14 days. That's kind of the period where you start leveling. But when you've got taxis taking people around the country and whatever, it's a petri dish for the coronavirus. It's a perfect way to infect other people. But that's allowed to happen. But a white lady with a little dog walking down the street with no one around, nah, got to be arrested. This is a bullshit that's going on in South Africa. And let's get right into the situation here. With South Africa having recorded its highest single-day jump in coronavirus infections, the Health Department has reiterated its call for those with existing diseases to take extra precautions. Now, I have seen reports that in the UK, the fatalities amongst the people of colour are 3 times as high as the fatalities within the Caucasian people. Now, that's not a racist comment. That is a factual comment, and you can actually go and look it up and Google it, and you'll see it's true. Now, you consider putting on into that formula HIV, AIDS, and TB, which are things that lower your immune level amongst the black population. This is, I've said this a month ago, this is going to be a catastrophe what's coming in South Africa. It's going to be an absolute catastrophe. Let's get back to what they're saying here. The newly added cases brings the total number of the infections to 6,336, which brings it very close to the level of coronavirus infections in Australia. Now remember, Australia was probably about a month ahead of South Africa when it got its first coronavirus, and it went through that curve going up and it's leveled down. Here in Queensland, where I live, there are only something like 90 active coronavirus cases. In other words, they're still infectious. 90 people in the whole of the state of Queensland that have that are still actively infected by the coronavirus. That's how well under control it's happening here, under lockdown. And we have a very soft lockdown. But in South Africa, because of the townships, because there's no social distancing, there can't be social distancing, which it's like shooting yourself in the foot. All you've done is you've destroyed the economy. Now let's continue with the story. The Western Cape remains the province with the greatest number of infection cases, now at 2,700. Now, most of those infection cases are in Khayelitsha. And guess what that is? It's a township. It's what I was talking about weeks ago. It's going through there like the plague. Remember, these are people who've actually been tested. And because the testing is so inadequate in South Africa, you can imagine how much higher the actual figure is in townships like Khayelitsha. Because a lot of the younger people will be asymptomatic, but they'll be passing the infection on to other people, because young people sometimes don't show the symptoms, even though they've got the virus. This is shocking. You know, I don't think it's going to take till September to peak. I think this is going to peak in what's month May. Okay, I think this is going to peak in June. I think you're going to find that the townships will just be a complete disaster. Let's continue. Okay, the Western Cape remains the province with the greatest number of cases now at 2,700, followed by Gauteng at almost 1,600 infections and KwaZulu-Natal just over 1,000 infections. The number of deaths in the country is up by 7, bringing the toll to 123 fatalities, which is a lot higher than the fatalities in Australia. We're below 100 fatalities from coronavirus in Australia, just for the record. Health Minister Zweli Mkhize said most of the deceased also suffered from. Now this is why I say, why are you having a lockdown to destroy the economy? Let's hear what the Health Minister says. Zweli Mkhize said most of the deceased also suffered from chronic diseases such as hypertension, diabetes, and cardiac disease. So these were people who were basically on you could call it like on the high risk end of things. So if this had been the flu, they would have probably had the same issue. They would have probably passed on as well. But somehow the coronavirus is now lockdown material in South Africa. It's totally ridiculous. I can't believe how ridiculous. Am I the only one who sees what's going on here? Really? Think about it. Okay, let me repeat what the Health Minister said. Now, we're talking about the fatalities in South Africa from the coronavirus. Health Minister Zweli Mkhize said most of the deceased also suffered from chronic diseases such as hypertension, diabetes, and cardiac disease. You know, 58 people a day die from murder in South Africa. And yet there's no lockdown over that, is there? Anyway, let's continue. Mkhize urged elderly South Africans over 63 years of age and those with existing diseases to take extra precautions. So there you go. Look, I think South Africa, using a first world strategy in a third world country, has completely destroyed the economy. The only thing that Ramaphosa can do is completely lift the lockdown and let this damn thing just go through, and as Bill Gates calls it, let the herd get infected. Let everybody get infected. Let it happen. Let it go. All right, there are going to be people who die. There are going to be casualties. But if you keep on destroying the economy, the suicide rate, the death rate from starvation is going to be far higher. And it's going to be infecting, well, the death rate is going to be affecting people who are younger than those old farts like me who, look, we've had a great life. You know, we're in our 60s, we're in our 50s, we're in our 70s. Why put younger people at risk through things like starvation when by lifting the lockdown you can allow them to start living again? You know, there is a complete and utter disconnect here. I don't know who's advising Ramaphosa, but he's doing a crappy job. I bet it's an NGO. And I wonder if it's tied up with the Bill and Melinda Gates Foundation. That would be very interesting to know. All right, guys, please remember to subscribe to be kept informed. Ring the bell for the updates. Please like this video. Please share this video. And above all, please stay safe. Bye for now.